Now, if the National Unity Platform were to offer an alternative policy paper on how to not only engage in this particular transition, the 90-day review period, but even after, what would it look like?
Thank you very much. I want to first of all start by saying that I don't like and I wouldn't want for us to take the conversation to how then can the other funders start to adjust. You know, we can't make our emergencies their urgency.
That is right.
Yes, and it is time for us to start to have these serious conversations. I'm not very happy that the US did what they did, but maybe it is an eye-opener. It is an eye-opener for us to go back and see, as the government of Uganda, where are our priorities? First and foremost, we have seen the Lubowa Hospital project, which should be an example, since 2017. Year in, year out, we are putting money into that project, which we would have expected to uplift our health sector. But we are not seeing that, but we continue to spend money there. For many Ugandans that may not know, CIPLA, or which is now known as QSIL, which is a producer of ARVs that continue to serve Africa, Uganda, and some parts of Africa, in West Africa, Central Africa, and all around there, is situated or is seated in Uganda. But then it is embarrassing that we are now dealing with a crisis that because the US has withdrawn aid, we have a manufacturer of ARVs in our country, but we are going to have Ugandans who are dying because we do not have access to medicines that we manufacture.
It's a private entity?
Yes, it is a private entity, but how are we then using that? Why are we buying shares in local industries and whatever they do, but CIPLA has been here and we've not had such kinds of conversations?
And it has been listed.
And it has been, Okay. So these are the kinds of conversations that we are supposed to have. And so then it goes back to we as Ugandans. And now I want to answer your question that what would be our alternative? It is time for us to realign our priorities. It is time for us to go back and sit on paper and say, why are we giving State House a supplementary budget of $2 billion for them to buy cars for the president's convoy? Why are we spending money to pay all these RDCs, to pay RCCs, to pay assistant deputy RDCs? So it is time for us to go back to table and realign our priorities. It is time for us to pick money from parts of the budget that are not critical and put them to where they are critical. And it is time for us to actually see that, can we survive as the Ugandan government? Can we fix our revenue leaks? Can we go back to the drawing table and say that the health sector, the education sector, these are sectors that need to be given priority before we go to these other things that we give a lot of money to? And so for me, and even talking about critical issues that's even now that they're prioritizing, and it is absurd that viral load, because as a pharmacist I know that when we are going to give our regimens for HIV, for ARVs, it is critical that you look at this viral load and you're able to tell that this person is now living under manageable conditions, or maybe they are susceptible to getting opportunistic infections, so they must have extra medicines that are added onto them.
That is right.
Yes, so most importantly, it is for us to realign our priorities as a country.
That is very, very poignant. The taxman should be able to tell us, local